Why is diabetes becoming a major health challenge in India today? In a very simple language, diabetes is when your blood sugars are persistently high. And don't be surprised to know that India is the world's capital for diabetes. So you can understand the magnitude of people who are suffering from diabetes in India. So diabetes actually affect our blood vessels and causes blockage in these blood vessels. And almost all organs of our bodies are affected by this blockage, and the most affected ones are the retina, kidney, and the nerves. So let me show you with some photographs how diabetes damages the retina. That is, what is diabetic retinopathy? So the first image is that of a healthy retina of a diabetic patient, but with time you can see there is bleeding that is happening inside the eye, this red spots. Furthermore, this bleeding is going to increase in number and it is going to come closer to the central part and over the nerve, and this causes reduction in the vision. When not treated at this stage, we'll have this next stage where new blood vessels form on the retina. These new blood vessels are the most dangerous part because it causes two major problems. First, it causes severe bleeding, and secondly, it causes pull on the retina and the retina gets detached. As you can see here, the bleeding is increasing and the retina is getting detached. And finally, it leads to blindness, and these stages are known as advanced stages. So who are at risk of having this diabetic retinopathy? So anyone who has diabetes has the risk of getting diabetic retinopathy, and this risk increases with duration and poor control. And this risk will increase further if you have high blood pressure, kidney or heart problems, high cholesterol and low hemoglobin. If you have multiple of these factors, the risk is even higher. You might now be wondering that I have diabetes. So how can I know if I have diabetic retinopathy or not? So let me show you three photographs. First one is that of a normal, the middle one early, and last one advanced. But all these patients can read newspaper without glasses, which means that you might not know if you are having an advanced stage because you have no symptoms sometimes even with this advanced stage. So you have understood that there is no specific symptoms for diabetic retinopathy. So the only way by which we can detect this disease is by a retinal examination, a fundoscopy or fundus examination, which is an OPD procedure and is very comfortable. By putting some eye drops, we can see the retina and know the status of diabetic retinopathy. I have made a tagline to create awareness about diabetic retinopathy, and this is check retina wellness, prevent diabetes blindness. Diabetes can blind you, and screening is the only way to detect it earlier. So speak to your diabetologist and ask them to get your retina screened for diabetic retinopathy. Let's all join hands and fight against diabetes. Please help us to spread this message to other diabetic patients so that they know the importance of eye examination. Thank you.